India has built one of the world's most ambitious digital public infrastructures for healthcare. Through the Ayushman Bharat Digital Mission, we now have the rails: ABHA for identity, UHI for discovery, FHIR for interoperable records. But one critical layer is still missing: the transaction layer. Patients can find care, providers can deliver it, yet affordability stays the barrier between diagnosis and treatment. That's the category Sanjeevani Setu creates: point of treatment healthcare financing, a transaction infrastructure connecting patients, providers, and financial institutions on one consent-driven network orchestrated by Saarthi. Saarthi coordinates identity, discovery, consent, records, payments, and financing into one journey. Let's see it in action. 3 connected experiences: patient, provider, financing. We'll start with the patient. First, let's test the platform's resilience. We intentionally trigger a verification failure. Instead of breaking, Saarthi detects the exception, queries the registry, and runs a controlled retry, guiding the user back. And, in the absence of an ABHA, Saarthi guides them to create one. Infrastructure must handle exceptions gracefully, not just happy paths. Now the real journey. Priya enters her ABHA ID, her Ayushman Bharat health account. Through the ABDM gateway, her identity is verified, her record discovered, consent initiated, onboarded in seconds. No paper forms, no repeated registrations, no fragmented records. Next, discovery. Through the unified health interface, Priya finds verified providers, with Saarthi personalizing recommendations. She selects Dr. Mehta, pricing transparent, credentials verified through the health professional and facility registries of the National Health Authority, and books. Trust indicators visible, the appointment is confirmed, consent already initiated. The real value begins when health data becomes portable. On the provider side, Dr. Mehta is verified through the Healthcare Professionals Registry. Her dashboard unifies consultations, records, and patients. When Priya arrives, the provider requests her records. This is how the health data gets linked to a patient's ABHA ID by leveraging ABDM's consent management framework: time-bound, purpose-specific, patient-controlled. The patient stays in control. The provider gains the clinical context for better care. Now back to Priya. Time to pay for her consultation. This is the point of treatment where affordability has always been the barrier. But Sanjeevani Setu transforms it. At checkout, she can pay by UPI or card, or access embedded healthcare financing right inside the journey. No separate application, no branch visit. Instant options through regulated partners. Providers gain payment confidence. Patients gain affordability. Lenders gain a new category of responsible lending. Sanjeevani Setu by Shoveltech, the transaction and affordability layer for India's digital health ecosystem, connecting patients, providers, and financial institutions through one healthcare journey.